Hello and welcome to Health Corner, a health education program organized by CHPNET. My name is Dr Rukengwa, and it is a pleasure and a joy to join you today and talk about breast cancer awareness. This is why I'm wearing pink too, just to support breast cancer awareness. Now, before we dig into this, I want to say something to everyone who is watching. Today's session is a wake-up call. It's an opportunity to raise an awareness of a condition that is important in the world. I want to talk to you personally. Yes, you. I would like, by the end of this session, what I'm hoping to achieve is to tell you what is breast cancer in general. Why is breast cancer important? I want to be able to tell you, and I'm hoping that you remember what I say. I want to tell you what are the factors that are important. What are the risk factors? What are the things that can increase the likelihood of developing breast cancer? I want to go even a step further and tell you how to examine yourself and when to examine yourself. And I'm hoping that by the end of this talk, you will be challenged, you will be encouraged, you will be motivated to do the right thing. Your body is very special. Your body is very important. Your life matters. Your life is important to you, to your loved one, to this earth, to this world. You have your place in destiny. And this is why looking after your body is something that is very important. And we're hoping to be able to achieve that through the various series of health information and health education that we'll offer you here in the Health Corner. Stay tuned. The month of October is a special month. The reason being that we talk about so many important things generally in the world. And two of the important things that I think do make up quite the highlights of the month of October include Black History Month. Before going into the details of the breast cancer, I want to just pause and pay tribute to two amazing Black women who played an important role in women's health. They've paved the path that many of us have been able to walk onto today. I want to pay tribute first of all to Dr. Helen Octavia Dickens. She is a medical doctor. He was one of the first Black women to receive the board certification in obstetrics and gynaecology. I am passionate about women's health. I am passionate about women's health awareness, but also general health education. But I want to mention her particularly because of the fact that she was one of the first Black women to have that certification in obstetrics and gynaecology. So we pay tribute to you today, Dr. Helen Octavia Dickens. The second woman I want to pay tribute to is a lady called Mary Beatrice Davidson Kenner. She didn't have the opportunity to really pursue a lot of education in her life due to so many reasons at the time. But she did something that was quite particular, quite important. She was a big inventor in the sense that she developed one of the sanitary belts that were used in order to support women during the menstrual cycle. And I think that's worth praising. So again, tribute to you, Lady Mary Beatrice Davidson Kenner. Let's move on now and continue on the breast cancer awareness information, which is the other thing that is quite important in the month of October. I want to start by saying that breast cancer is important. It is an important topic worldwide, and it is worth us talking about it. I want to start by mentioning the fact breast is an important part of our body, whether you are a man or a woman. And of course, because of the way it is formed, there are different things that can become diseased and cause various symptoms in breast cancer. But why is it so important? Well, it is because breast cancer is the leading cause of cancer death in women. And that means, what that means, I just want to be able to put that in context. For a lot of the cancer death around the world among women, breast cancer is the leading cause. Whether it is from a cancer that purely started in the breast, or a cancer that later on developed because there was a breast cancer in the past, breast cancer is a leading cause of cancer death in women. Essential information number 2. 1 in 8 women develop breast cancer in their lifetime. It doesn't mean to die from it. It doesn't mean that they will not recover or cannot be treated. But 1 in 8 women develop breast cancer in their lifetime. And I think that is important. And this is why I said at the beginning, it's a one-on-one talk. We're bringing you this information because your life is important. Your health is important. Your body is important. You are important. And you deserve to be informed so that you can make the right decision, take the necessary steps to look after this special body, this special person and being that you are. The incidence, essential number 3, the incidence of breast cancer is lower among the diverse ethnic groups compared to the Caucasian or white communities or groups. But the black women are more likely to be diagnosed with more advanced breast cancer than the white or the Caucasian groups. This is very important because studies went into this to try and understand why that is the case. Why is it that black women, when they're diagnosed with breast cancer, tend to have the cancer that is far advanced, that is more difficult to treat, that is very difficult to control, that has quite a poor outcome? And a lot of studies have gone into this. A lot of research and investigation is being done into this question. And some of the possibilities or some of the proposed contributing factors include things like late diagnosis, because not a lot of black women go for screening, breast cancer screening. Not a lot of black women are aware when the breasts begin to change and they need to do some examinations. A lot of black women avoid screening. And what I'm hoping that through this session, that you'll be encouraged that when it is time to do your breast screening, that you will go for it. What is screening for? I think this is something that maybe is worth mentioning or talking about before moving on to the next essential point to make, or essential fact regarding breast cancer. The purpose of screening is to detect a disease before it occurs, or at least early enough to when you can actually do something about it. So when you're well in your body and it is time to have screening, that is when you need to go and have the screening. You do not need to wait for symptoms to be screened. When it is time to do your screening, whatever the screening may be, whether it's cervical, whether it is bowel screening, whatever it is, but in the context of this talk, we're focusing on breast screening. So whatever the screening is, when it is time for it, go for it, even when you do not have symptoms. Because the purpose of screening is to pick up the disease early enough, or even when it has not yet manifested, for you to be able to treat it. Now, when you think about how cancer tends to be a progressive illness, meaning that it starts somewhere and keeps growing and expanding, trying to take over. If people are screened and the changes in their breast that may develop into cancer are picked up early, they can receive the treatment early. But when they're not screened and the disease has already progressed, by the time they are being screened and checked, they've already developed the disease is already in a stage that is quite aggressive and leading to poorer outcomes. I will pause there just for you to think about what I've said before I go on and talk about the next essential fact, which is men can also develop breast cancer. Though it is commonest in women, men can also develop breast cancer. And when breast cancer, it tends to be quite, sadly, an aggressive type of cancer. But then again, there are a lot of treatments available today to be able to provide people who develop breast cancer with great support. The next thing I mentioned when I was telling you about my introduction, about what I'm hoping to communicate to you today, I want to go over the risk factors. I will group them in 3. The risk factors that you can modify, the risk factors that you cannot modify, the risk factors that are linked to your reproduction as a woman. What are risk factors? Risk factors are things that can predispose you or perhaps increase your risk of developing a certain condition. In the context of our talk, the risk factors are mainly linked to developing breast cancer. I'll start with the modifiable risk, or the ones that can be modified, the ones that we can do something about. There are 6 I want to mention. But there are 6 I want to mention. Postmenopausal obesity. When a woman has gone through the change, usually this happens after the age of 47, so between 50 to 52 years of age. Though it may happen sometimes earlier, but in a general context, when you go through that change, there is a tendency to put on weight. And here, one of the factors that may increase the risk of developing breast cancer is if you do not take charge of that postmenopausal obesity. The second factor include premenopausal low BMI. This one is for women who are very underweight before the change. So before you go through the menopause, or when you change, before you get to that stage, if you have very low weight, general weight, not the birth weight, but your general weight is below the recommended BMI, then there is a slight increased risk of developing breast cancer. Other things include lifestyle, alcohol, smoking, poor diet, poor physical exercise. A lot of studies are beginning to come out about physical exercise, that even daily walking has great advantages onto one's health. Next thing, being on the combined hormonal replacement treatment after the menopause. Now, this is quite a big topic that one needs to understand and explain a lot of these things in the context. But from a general sense, from a general information context, combined hormonal replacement therapy, or HRT, after the menopause can increase your risk of having breast cancer. But there are particular contexts to which it applies, not all contexts. The sixth point, but not least, in the group of the factors that we can modify is early menstruation. So girls that have early menstruation have got a slight increased risk of developing breast cancer. Not all, some. This is something that you can't really also control, because you don't always decide when your body is ready to start the menstruation. But it's important to know that some of the things that can help, even in younger children, is to maintain a healthy weight, is to maintain an active lifestyle. Because when you have a lot of fat cells around, they can affect the estrogen and various hormones in your body and can trigger some of the changes that may lead to early menstruation. Not all, but some. And this is why the aspect of that can be controlled is perhaps working on maintaining or helping our little children stay within the recommended body weight. I'm now going to move on to the risk, or the group of risk factors where you cannot really modify. It's beyond your control. There's nothing you can do about it. You're born like that. You've got this or that. You can't do anything about it. One of them is quite obvious. It's increasing in age. No one goes backward. Everybody goes forward. So the numbers of our age go this way. They always go that way. So that's one of the factors. Increasing age is a risk factor of developing breast cancer later in life. Being a woman, a female, is again a risk factor compared to men. Being from a white ethnic background or Caucasian community groups, again, is another risk factor. But remember the nuance in that. Though the incidence is higher in the Caucasian group of patients, but the severity of the illness is quite significant among the black ethnic groups. So just to bear that in mind. One modifiable factor, another one include family history. If there's been people in your family, direct family members, mother, sister, auntie, who have had breast cancer either earlier on in life, potentially it could be a risk factor as well. Certain types of breast tissues that people have naturally, either dense or slightly arranged differently, could also increase some factors of developing breast cancer. And of course, the genetics of our bodies. We do not control what kind of DNA we're made of, but some people in their genetics may have a slightly increased risk of developing breast cancer. So if you need a lot more details about some of this information, you can just speak to your GP, and there is a lot of information regarding how to get help or information regarding breast cancer. The third group of risk factors that I mentioned, I said it has to do with the reproduction. So girls or women who have their first pregnancy later on in life have a slightly increased risk of developing breast cancer. What do I mean later on in life? Above the age of 35. It doesn't mean everyone. It means some women may have slightly increased risk compared to others. Women who do not breastfeed after they've had their children, again, have got a slightly increased risk of having breast cancer. Last but not least, women who have never known parity, again, there is a slight increased risk of breast cancer. I really hope that this information regarding the importance of breast cancer, why we talk about it, what is important, regarding the risk factors of breast cancer and what you can do to tackle the modifiable risk. I hope this information has been useful to you. The next thing I want to tackle now is looking at what is already available that maybe you're not aware of. Did you know that the NHS offers screening for breast to all women from the age of 50 to 70 years old? And you get a recall every 3 years. If you did not know, now you know. And if you are in that age group and you know someone in that age group that was not aware of this information, please let them know. It is free, it is available, and it is very important for you. Remember what we said in the beginning. The purpose of this talk is to empower you, is to inform you, because your life is important, your body is important, your health is important, and you are the best person who can get involved in looking after it. When you have your screening, it involves simply a scan of your breast tissues, and depending on what they see, they may decide to do take a sample to analyze more or not. So it's something that is quite straightforward, and the team will give you all the information that you need in order to be able to have the procedure done or the screening done in a positive way, in a comfortable way. Another update I want to give you today, so that perhaps if you were afraid to have screening because of what you might find out, or you were afraid that, oh, there is a family history, I don't want to know, I don't want to find out, because I just want to live my life, whenever it happens, it is your right. But let me just tell you that treatment of breast cancer today has made some tremendous progress. So there is now quite a lot of women that can live longer even after a diagnosis of breast cancer. There are a lot of treatment that can support you, that can help you get better if you ever need to be treated for breast cancer. So get the help, get the screening if need be. Don't be afraid of what is going to be fun, what they're going to see, because whatever they see is better it's been picked up early than not. How do you then check yourself? Now, studies are beginning to show and suggest that it's actually not good practice to just start examining your breast without any reason. The reason being, it creates unnecessary anxiety, it puts you through unnecessary investigations and testing that may yield and come back normal. So, not beneficial. When does self-examination becomes important? Get in the habit to look at your breasts in front of a mirror. If you notice a change in your appearance, in sizes, or you notice some sort of pain or discomfort, then do a self-examination. I have been able to find a nice summary of the steps you can take to do a self-examination. If in doubt, speak to your GP or contact CHPNET, contact the Health Corner, so that they can explain these things and maybe direct you where you can find more info. It's very simple, it's very easy. It takes different motion and you need to examine the two breasts. So even if you notice that one is looking a bit odd than the other, you still have to examine the two so that you can tell the difference. It's very important. So the slide or that picture will be shown to you so that you can have a look and go through it and see how you can examine your breast. If you notice anything that has changed in your breast, even if you do not find anything on your examination, but because from your assessment or from looking at the mirror, you could see a clear difference, something that is not looking right. It wasn't like, my breasts were not like this. Now one looks red, the other one is clear, or one is got the nipple is looking funny shaped. It wasn't like this weeks ago or months ago. Please, after you've examined yourself, speak to your doctor to examine you too. Because the worst that can happen is that you get a screening and they find out what's going on. Otherwise, you get informed and you get reassured if all is well. To summarize, breast cancer is important. It's the leading cause of cancer death in women. It affects all ethnic groups. Mostly, the incidence is higher among the white or Caucasian groups compared to the diverse ethnic groups. But those in the afro-caribbean or the Black community groups tend to have more advanced form of breast cancer compared to other groups. There may be several factors that contribute to that, but some of the few that have been proposed include maybe to do with genetics, but also possibly because of the poor uptake of screening services among the Black community groups. Breast cancer is treatable. There is no guarantee that it may not come back in one form or another, but there has been a great advancement in treatment in order to improve the qualities of lives, in order to support people who develop the condition. Screening available either for early detection or before the disease manifests in its aggressive form. And I urge and encourage those who are eligible to actually take advantage of the breast screening program that is offered via the NHS from the age of 50 to 70. I hope I have encouraged you. I hope the information has empowered you to do the right thing, which is looking after your body, because your body, your health, your life are important. Before I end, before I say goodbye, there's a famous quote by Angela Mayi who says, "People may forget what you said, people may forget what you did, but people never forget how you made them feel." I really hope that the information you received today made you feel able to make a difference and look after yourself. Send your questions in, send your comments in, share to whoever you think this might be helpful to, and see you next time in Health Corner. Have a good day.